Bowser. Our regularly scheduled program will resume following the announcement.
Okay, thank you. Good morning, everyone. I'm Muriel Bowser, Mayor of Washington, D.C., and today I'm joined by members of my cabinet, and we will provide an update to the district's response to COVID-19 and take your questions. I want to start by reminding everyone that I have enacted a heat emergency, I think for the 4th day. People should be careful when spending time outdoors, and if you need a place to cool down, to please locate a cooling center in each of the district's 8 wards by visiting heat.dc.gov. You may also call the district shelter hotline if a person experiencing homelessness is in need of help. You can dial that number at 202-399-7093. The city will also provide transportation assistance to those residents. I also want to mention that we will resume testing at our public supported facilities today, weather permitting. While some of the heat we expect this evening to have subsided, we may be visited by thunderstorms. So you still want to check in with those locations because it may be that we have to suspend at those sites because of thunderstorms. So once again, if you're in need of testing before this evening's time, you should always consult with your doctor and see if the doctor can provide that test. This afternoon, 4 to 8, we plan to be at Engine 4 on Sherman Avenue, Engine 11 or 14th Street Northwest, Engine 24 on Georgia Avenue Northwest, and Engine 31 on Connecticut Avenue Northwest. You can save time by pre-registering. You don't need an appointment, but you will be asked to provide information, and you can do that before going by visiting coronavirus.dc.gov/register. Today, we also want to spend some time talking about what we are seeing with the virus in the district, as we have been talking with you about for the last week. We are seeing upward ticks in cases, and today certainly we saw upward tick in cases as well as trends going upward with some of our other metrics. So I'm going to ask Dr. Nesbitt to spend some time talking about some of those cases. And Dr. Nesbitt, I don't know if you have it in front of it, if you could start with today's cases.
Sure. So we have in the district today, you will note on the website that we will report 102 cases. And that is, of course, a concern for us if that type of trend will continue. You'll see the metrics here that we report on the website. We will continue to monitor those. And as we mentioned last week, not being able to consistently see a trend in declining in community spread, the number of cases that we do see and our peaks are above the first day or day 0, when that day was the number of cases were in the low 40s. And we've seen a number of days since then where we have 60 or more people experiencing symptoms on a given day. And that provides concern for us. We also have, again, a number of cases that are not connected or cases that are not coming from people who were previously in quarantine, and that begins to concern us. periodically look at on a daily basis or on every other day who comprises our cases. And we do routine surveillance on a weekly basis. Director Geldart gives an update on the number of tests that we are doing that are publicly supported. And the publicly supported cases that we are doing in the district consistently is over 1,000 per day. We will post some lower numbers over the past 2 days because of the heat emergency activation that required us to scale back our firehouse testing and have reduced hours at our other testing sites, but our long-term care facility testing surveillance program continues. We are starting to see some trends in our long-term care facilities and intermediate care facilities that are concerning to us in terms of the number of staff in particular, not necessarily residents, that are beginning to test positive in that population. As you all know, that's a vulnerable population that concerns us. It's a population that we do testing in that population weekly to be able to catch these things very early, to be able to do interventions, to go in and to make sure that staff are wearing PPE properly, to be able to remind staff who work in those facilities, just as we remind individuals here, to choose their activities wisely, because the things that we do outside of our workplaces can create exposures and risk for the things that we do in our workplace and exposures to individuals who may be at high risk. So those are some of the trends that we are observing and want to be able to catch very quickly. If you go to the next slide, we are also beginning to see some new trends by age group. Prior to July 1, and you have to be mindful that when we're talking about prior to July 1, we're talking about thousands of cases, and after July 1, we're talking about hundreds of cases, right? So the order of magnitude is different. But what is of interest is the proportionality is something that we have to be mindful of and pay close attention to. Since July 1, the proportion of cases in the District of Columbia that are beginning to occur in people under 40 has begun to have us pay attention to, are there types of activities or types of locations where individuals in these age groups may be going, or types of behaviors that may be more common in individuals under 40 that we need to emphasize for increased social distancing or changes and modifications in behavior. So 66% of cases in the district since between July 1 and July 20 happened in individuals under 40, where before July 1, it was 41% of cases. The other things that kind of go along with this is that the test positivity rate in individuals under 40 is 3.4% compared to individuals 40 and older. And so we also have seen the same trends reflected in our hospitalizations. It should be noted that when you look at hospitalization data, I always want to make sure I give this caveat. The hospitalization data that we publish on our website is inclusive of residents outside of the district. So when we have people hospitalized in DC hospitals, so the data that we publish reflects people regardless of residency. We don't scrub that data and only publish hospitalizations for DC residents. So the daily data that we publish includes people who may be residents of Maryland, Virginia, and even other states further away. So we have the opportunity to scrub the data and look at just DC residents and our hospitalizations for DC residents. And we're starting to see some trends there where before July 1, 16% of our hospitalizations were occurring in people under age 40, and now it's 29%. So we are beginning to see some of those trends. And I want people to be able to understand that this is not just a trend where we're only seeing this in the age groups of like 21 to 40. We've seen increases in the number of cases in the age group of 14 and under. So I know there's a lot of conversations nationally that occur as to whether or not children are immune, children can spread. There's still a lot we need to learn about children. There's still a lot we need to know about the risk and ability of children to spread COVID-19, SARS-CoV-2, but we are seeing an increased percentage of our cases happening even in the age group of individuals less than 14.
Thanks, Dr. Nesbitt. We also want to spend some time talking about testing. And one behavior that we are concerned about is people who are getting tested because they either don't feel well or because they believe they have been exposed are not staying home and quarantining. They're still going out. So what DC Health wants to emphasize to everybody is that if you go to get tested because you think there's a chance that you were infected, then you shouldn't be hanging out with friends or going to the store or going to parks because you could be spreading the virus. So if you need a test, we want you to go get a test, either from your doctor or from one of our public health sites. But we also want you to stay at home post-test to monitor your symptoms. We also have some concerns about the behaviors of staff and patrons at food establishments. We know that for the most part, our businesses are doing the right thing, and they are doing the right thing to keep staff and customers healthy and safe. ABRA has done a significant amount of public education to our business owners, including sending inspectors out to talk to people and issue warnings. So far, 2 $1,000 fines have been issued, and 15 other cases will be decided tonight. So moving forward, however, inspectors will be able to issue fines on the spot when they observe violations. So obviously, this is not something that we want to do, and we need to ensure that everyone is doing their part to keep the community healthy. Additionally, residents can file a complaint at abra.dc.gov/service/complaint. Or a resident may call to lodge a complaint at 202-442-4423. I am also today signing a new mayor's order on masks. And basically what it says is if you leave home, you should wear a mask. The mayor's order lays out some exceptions. Common ones are for children under the age of 3, if you're vigorously exercising, if you are actively eating or drinking, or if you're in an enclosed office alone and no one else will be coming in. But in most cases, if you're outside of your house, you should have a mask on. This means if you're waiting for a bus, you must have on a mask. If you are ordering food at a restaurant, you must have on a mask. If you're sitting in a cubicle in an open office, you must have on a mask. We know that masks are effective and are an effective tool in helping us stop the spread of the virus. So before we take questions, I want to remind everyone why we need to do everything we can to stop the spread of the virus. We know that without a vaccine or a cure for COVID, we have to continue to take precautions. But in other parts of the world, they have been able to significantly reduce the transmission and get the virus under control. Ideally, we would have more coordination at the national level, and we're going to continue to demand that. But we're also going to do everything that we can locally. But because the longer this virus sticks around, the worse it gets for everyone. We want our students to be able to go to school, workers to go back to work, restaurants and businesses to be able to open, arts and cultural institutions be able to serve us all. And we're all pretty sick of dealing with the pandemic. We're 4 months in, people are tired, and in some cases are letting down their guards. But we all want to get on the other side of this virus, so it is important that we remain vigilant. So with that, we'll answer a few questions. Yes, Sam?
So the mask policy, does this mean like if you're walking your dog, you should have a mask?
Yes, it does.
And would the police, how would the police enforce this?
The police won't be able to make everyone do what they're supposed to do. So we need people to understand the rules and to follow them.
So basically, if you're outside of your home, outside, you should have a mask.
You should have on a mask because you don't know if you're going to be able to maintain social distance. Yes.
This is a new level, right? This is the first. Been at this level of, that you, I mean, previously, I feel like the language was always, if you know you won't be able to.
Here is the big difference, is that we have separated the mask policies into its own mayor's order or part and above DC health guidance. But I really can't remember the last time that I gave a briefing where I didn't tell people to wear a mask. So this is for emphasis. The guidance will lay out some exceptions that we've been asked about repeatedly. But the emphasis is on if you're going out, wear a mask. Because if you come into 6 foot of somebody else, this is going to protect them and all of us.
But is there any penalty? That's what I'm asking.
There will be enforcement language in the order, Sam, yes.
Okay, question?
Any other questions? Yes, sir.
So, can you, maybe Dr. Nesbitt can answer this, or the mayor can talk to it about, and I appreciate that you went through very detailed about the under 40, but what does that mean? I mean, you talked about the behavior that they take part in that some of us who are older don't take part in, and I'm just wondering, is this a signal that maybe phase 2 started too soon, and that maybe opening the bars, opening the restaurants?
We haven't opened bars,
Well,
Mark.
not bars,
Okay.
but opening restaurants to inside dining, and we've seen, obviously you've seen people violating it, so some bars are violating the order and serving people like they shouldn't be. Does this indicate that maybe phase 2 started too early?
I don't know that in what Dr. Nesbitt has seen so far is that we're finding restaurants to be a major source for people, but that's certainly something that DC Health will continue to look at. So if that was your question, there are a lot of activities, however, in phase 2, including going to playgrounds. You might say, did we open playgrounds too soon?
Did we go to phase 2 too soon?
I don't think so, but certainly what we're called, because we've always said this, that we can dial up activity or dial back activity. And when we look around our region, I mean, I think that is a question that we would say for the whole region, or if we look at our country, that's a question that we would have for various regions in our country that skipped phases. We don't exist in a vacuum. So we will spend some time looking at all level of activity and seeing what we have to dial back.
And then if I could follow up, given what Dr. Nesbitt said about children under 14, that number going up, and then just every day we're seeing more and more new cases. You know, a couple weeks ago we were in the 30s, now we're in the 70s, 80s, over 100 today. I know you said you're not going to make the decision until July 31st, but is it realistic to expect in-class learning for students? We've seen every jurisdiction that surrounds DC now, Fairfax, Montgomery, PG, have all come out and said, at least for the first semester, it'll all be virtual learning. Do you see a scenario where students go back into the classroom still in August?
We haven't made a determination, Mark, and I think what the last week has shown us that we always knew is that the situation with the virus is volatile. The closer we get to needing to make the decision, the better information that we have. Yes.
Yes, Mayor. A group that seems to be linked to the Urban League is suggesting that there is a gap between Black and Latino and white students in DC in terms of having access to Wi-Fi to be able to learn at home. They're saying, for example, that 27% of Black students don't have access to Wi-Fi in DC. What are your thoughts on that?
Well, I think that that's kind of like one of those statements that is so obvious that we know that there are gaps in educational access. And that is why we spent a lot of time during the shutdown of the schools in March, making sure that we were not only providing our students with devices, but with hotspots that will allow them to connect to the internet.
So basically all students at this point have access to Wi-Fi to be able to learn at home?
If they don't, their parents will be telling DCPS what they need when they register, and we will be able to supply what they need. And but that's only one piece of it. So when we talk about distance learning, just providing kid with a connection is only one part of the experience. And not all children have the same supports to be able to make the most of distance learning. And certainly not all children will be able to make the social and emotional connections that they would at school with distance learning. So I think we would be doing a disservice to our families if we only talked about distance learning being effective because there is a device and a connection to the internet.
I have a question for Dr. Nesbitt.
Mhm.
On this, we see the numbers going up, but it seems deaths are going down. I noticed there were no deaths today. I think I read that correctly. Is there a reason for this? I mean, is the medicine better? What are your thoughts there?
So we've always known that there's approximately a 2-week lag between many of the indicators, or the 3 core indicators that the people tend to focus on and that we tend to measure, such as the number of cases, then hospitalizations tend to lag after that, and then deaths tend to lag. So tends to be a 2-week lag for those 3 measures or specific indicators. What some folks are observing in some jurisdictions is that if the proportion of cases, the shift from being more in elderly individuals to younger individuals, you may see even a greater delay in the hospitalizations and deaths. From it typically where it's 2 weeks, you may see those delays for 2 to 3 weeks because if you're seeing a shift in the proportionality. While the severity of illness may be lower in younger individuals, it does not mean that they are not hospitalized in ICUs and that they are not succumbing to the virus, because that still does happen in the 21 to 40 age group in individuals from 40 to 60, where it may not happen at the same rates or the case fatality rate may be lower, it still does happen in those populations. So those may be some of the things that are happening. You mentioned therapeutics. There are 3 therapeutic interventions that are being used right now. Only one has been shown to lower the death rate or risk of mortality. The other ones tend to shorten the length of stay or the length of time the individual is experiencing the virus in the hospital. So I would not say that right now therapeutic interventions is what's causing the decrease in deaths in the district.
Yes, ma'am.
Dr. Nesbitt, you have these statistics here on contact tracing, and you're reaching 97% of close contacts, which sounds like a really high, excellent number. And I wanted to ask about what you're seeing when you reach those people. Do you have any numbers on how many actually pick up the phone and engage with you and quarantine at home?
Yeah, so we talked about that Monday, where we're catching about 65 to 70% of individuals have a completed interview. Now the number for the past 7 days is less than 5% of people we don't have complete contact information for. And that's large and in part to the number of partnerships that we forged with community-based organizations, our health centers, and helping to prepare people for the contact tracing process and ensuring that individuals who are being tested are providing contact information that is useful and meaningful and will help us have a successful contact. We are, as we announced earlier this week, deploying a home visiting program that will help us reduce the percentage of individuals who do not have a completed interview. It should be noted that some of the percentage that contributes to not having a completed interview are, folks who are hospitalized, who are too sick to participate in the interview process. So that number, it will be very difficult to get it to completely 100%. For completed interviews, because some folks just simply cannot participate because of their health status.
Can I also ask about this rise in young people? Do you have thoughts on why this is happening? I know a lot of young people have jobs that they have to go to work in person. Are there other reasons that they're more exposed?
We've observed some, in the interviews, we've observed some behaviors that we don't believe are essential. So some people are traveling to hotspots and are reporting that as part of their history. We have some people who are traveling to youth sports tournaments and participating in activities that have not yet been permitted or allowed in the district. We have people who have traveled for vacations in hotspot areas, including Texas, Florida, the Carolinas, and even some beaches along the Atlantic coast as part of family vacations, group family vacations. Those things have tended to be common themes that we've seen in some of these interviews.
Yes.
Mayor Bowser, the state of emergency expires on Friday. You've said you're going to extend it. Does this mayor's order speak to extending the state of emergency?
I will issue a separate mayor's order to extend the state of emergency.
Will that be today, or is that?
Yes, it'll be today.
Okay. Will there be any changes? You had indicated that there may be some procedural or technical changes.
It is largely going to be the same, Mark. I think it's largely the same.
Okay. Traffic enforcement, rush hour, those kinds of things will remain the same?
Yes.
Okay. And then last week, Governor Hogan announced that their unemployment office had uncovered a massive amount of fraud due to out-of-state claims. The district obviously has a lot of people claiming from out of state who work in the district because you file where you claim. Has the district seen any kind of fraud like Maryland has seen with unemployment claims?
Our department has not called out any particular concern with fraud. We have, as you know, we instituted a pretty significant fraud check throughout the claims. That doesn't mean, I don't think we've had an audit yet, so I can't say for sure. I can say we're aware that there is that the FBI is doing an investigation nationally. So I'll get a more detailed briefing on what that entails. Yes, sir.
A couple off topic.
Okay.
I know you signed on to a letter expressing concern about what we're seeing in Portland with masked law enforcement agents. What can you tell us? What's your fear? I mean, we've seen something close to this, and I mean, not quite what Portland has seen, but we've certainly seen unidentified law enforcement agents on the streets of DC in the past. What are your fears, and what happens? What are you prepared to do if those units come to DC on DC streets?
Well, Mark, it's very concerning to us. As we said, as I told my fellow mayors, we saw this 6 weeks ago. We told you it could come to any city in America if they could get away with it here. And I think what you see the mayors and the states that those cities are in, looking at every legal avenue to prevent an encroachment on their sovereignty. And so I think that there are some major governance questions there, but I think there are also some very practical local policing issues there. In a time when our country is embroiled in a policing discussion, it exacerbates the tension to have unidentified police forces in cities. And so all that combination makes me very concerned about public safety.
Is Chief Newsham giving any guidance to his officers on what they should do if they find themselves in a situation where there's a DC police officers and then these unnamed law enforcement officers trying to take people into unmarked vans, if MPD might intercede in a situation like that, or would they be given directions just to stand back if it gets to that?
I don't think that the chief has issued any additional guidance, but I'm sure that's something that he's that's on his radar.
And then while we're on the topic of police reform, the council emergency legislation made it to your desk. I know you reviewed it. Have you signed that yet? What's the status of that on your desk?
I haven't signed it yet, and I have some bills I think to sign today, so it'll be part of what I
So you'll sign
review.
that today?
I have it to review, to sign or not to sign.
I'm sorry, I'm confused.
Why?
Well, you are going to sign it today, or yet, are you going to sign it today?
I haven't yet, and I haven't decided if I'll sign it today.
And then what can you tell us just about your reaction to all the violence, the shootings that we're seeing daily on the streets? The 4-year-old shot in the face, I mean, just there's, every night people are bombarded now with images of the pandemic and violence.
Well, Mark, I am, as mayor, the public safety issues are always on the top of my mind for every neighborhood. I don't think it's right for any Washingtonian, no matter where he or she lives, to be scared to walk out the front door. And so we will use every tool in our power to get this under control. We have had several high-level meetings of our public safety team on additional tools that we may need and additional strategies to deploy. So we continue to work on that and to change our deployment in every way that we can. Unfortunately, I'm going to forget the day now, Monday, I think, I was on 14th Street in Ward 1. And what I saw was a daytime shooting. I saw neighbors out. I saw patrons in restaurants, and a person who could just shoot up a street shows a brazen indifference to life. And so we need everybody, all hands on deck, from police to violence interrupters to council members to ANC commissioners, to be focused on how to make sure that we can keep our community safe. Yes, sir.
It feels like kind of a confusing moment in governance, or in the way that we're dealing with the virus, and that you know, your administration and other health administrations are looking at the numbers and urging something, you know, to slow down, perhaps conservatism, tighten up our games. But at the same time, the National Gallery of Art opened Monday and the zoo opens on Friday. Can you speak to some of the complexities of that moment and how what kind of messages people are receiving, perhaps?
Well, I think that all of us have focused on a plan that's fairly conservative in our reopening plan and the types of activities that could open in phase 2. And I'm forgetting what date we embarked on phase 2, but we're several weeks into phase 2. So some activities that, you know, arguably could have started 4 weeks ago are either people are thinking about starting or have started turned down. And all of those venues have the ability to do that. Yes.
On the council meeting yesterday, the council didn't vote on the budget quite yet because they're trying to figure out what to do about $18 million in cuts they would need to make if they roll back this advertising tax. Do you have recommendations of what you would advise to them that they cut, or if you would recommend keeping the ad tax?
Well, be careful about saying cut, because when you say cut, I think it suggests to people listening that there's something being taken away.
Right.
What they need to do is cut their spending increase proposal by $18 million.
Right.
So they would be rolling back something that hasn't started. You
Right.
follow me?
Yes,
Okay.
that's exactly right. Are there items in their current budget that you would say should be the ones that they shouldn't spend those $18
Well, as I
million on?
understand it, they increased spending by $300 million in the 4-year plan. So there are ample opportunities to roll back that spending. Yes.
Mayor Bowser, one more question on your mask order. There have been some concerns raised about DC police officers not wearing masks when they should. Can you clarify what the directive is for police officers, if this is a concern and if it's being addressed at NPD? And what should people do, what should residents do if they see police officers out in public not wearing masks?
They should let the department know. And DC police are required to wear a mask when they cannot social distance. And I have talked to the chief, who will emphasize that with the command officials and the officers. So I'll just read a statement from not a statement, this is a little. Current MPD policy on the use of masks requires that all on-duty sworn and civilian members shall wear a department-issued or authorized mask whenever social distancing is not possible. And it has been, this order has been in effect since May 15th. Thank you, everybody.
We now return to our previously scheduled program, already in progress.